This is an overview of Numera Navigator, a communication and collaboration platform that enables care teams and patients to better manage chronic conditions. To begin, we have logged in as a provider, and this landing page you would see, which allows for management of multiple patients within a registry. So on the left-hand side, you will see a list of the patients enrolled in this program or the patient registry. We also provide a search feature and functionality, so you can search by patient name, by ID, or by last name, etc. Now, if a professional user wants to add a patient to the record, they can do so in this form on the right-hand side with the Add Patient form. They can enter in a first name, last name, and personal ID, and the personal ID will be a unique identifier for this individual within our system. Now, the other thing that we have provided, specifically for professionals managing multiple patients, are certain tools that allow them to manage hundreds of patients, and one of the tools is the Patient Management tool that you see right here. And this tool actually allows for management by exception. So if patient's reading is outside the limits that have been set for the registry as a whole, then that patient then gets flagged within the Patient Management tool. So I'm going to take you to hypertension and show you an example of a hypertension patient management tool. So what you see here is the Patient Management tool, and you see that one patient is appearing on the list here. And if I click on this red flag, I will see why Nadja is appearing. And I see that the reason is because she had an extremely high reading taken on the 20th of April. So I get to see her information. I can cancel it, I can review her record, and I can actually even go into her patient record from right here. But again, if you think about it in terms of workflow, think of a nursing home. The nurses come in, and every day they come in here and take a look and see if any patient has readings that are outside the limit that they have set for the registry. And they can go to this, and they can go into the patient record. They can review the charts and graphs and readings, and then they can come back and say, okay, this patient has been reviewed, and the patient doesn't appear in this list any longer. And then, if you want a care team working on the same set of patients, it is very convenient for them to use this tool to manage them. And actually, this is for hypertension, but similarly, there could be one for diabetes or COPD, etc. So we are going to go back to the home page, and the second item I am going to show you here is the population report. Again, the idea is to be able to get an indication of the overall health of your patient registry. So we have prepared this population report that takes all the data that has been uploaded by all the different patients and categorizes them into a report that a healthcare provider can look at and get an idea of the overall health of this population. For example, for blood pressure, you can see the different ranges, and I can see, okay, most of the patients are within the 160 to 100 range, and so I can tailor my interventions, and whatever education materials I provide can be tailored towards that population. Similarly, you can have other metrics, such as BMI and several other metrics that you are gathering within this application. So I am going to go back to the home screen. And before I get into the patient record, I'm going to show you one additional thing on this screen, which is the messaging section. And the messaging section provides secure messaging between the healthcare provider and the patient. It can be used to convey information to the patient. So for example, I can send out information to my patient Nadja that she needs to come in for an appointment, or Nadja can message me to ask for an appointment. So it can be a feature of communication, and it also allows not only for one-to-one communication between the patient and the provider, but a patient can also message a care team. So if I am, for example, on vacation, somebody else on my care team can get the message and they can continue to provide care. So this tool is very simple in terms of you have an inbox, a sent, and a drafts tab. But keep in mind that this is secure messaging within the application, so the patient would need to be logged into the Navigator patient portal in order to do this kind of communication. Now also keep in mind that it is not necessary for the patient to have access to the application. They could be just uploading, and you could have your nurse team viewing the data in here, and the only thing you wouldn't have is this messaging feature, because they wouldn't be able to message within the application. So let's talk a little bit about the tools available for the care team to manage the registry of patients. Now I'm going to go into the patient records and talk a little bit about some of the features and functionalities that we offer there. So I am going to go into the record for Nadja Plinge. And when I go into her record, I can see it's her name here and her ID number. I am in her summary screen, and this screen provides a couple of interesting functionalities and features. First of all, there is a to-do list. So as a nurse or a care team member, I can actually put in certain tasks that Nadja needs to complete. For example, take your blood pressure or complete your questionnaire. So I have that ability. On the other hand side is a sort of log of recent events or people who have touched this particular record. It's really great for audit trail, so I can see who has accessed this record and what changes were made. If I select View All, I can actually get more information as to the date and time. So again, if you have a care team accessing this record, you can see where Nadja accessed it herself or where someone else accessed it for her. So I am going to go back, and below on the summary screen, we also have some trackers that are being tracked for Nadja. So these are biometric data that this specific patient is tracking. Currently, we see she is tracking her blood glucose, her blood pressure, and her steps. I can click into blood pressure from right here, and it will take me to the Tracking tab. And under Tracking, I can see her blood pressure. I see that 14 readings have been taken. There is systolic and diastolic. Below that, I have the ability to see the tabular format of this data. Date and time, systolic, diastolic. I can see what the current reading is, and I can even add a goal if I want to. And if a patient is manually adding data in, you can select Add New, and here you can go in and manually add the data. So here, we also have a very robust notification and reminder section. That is the next tab we are going to look at. And if you recall the patient management tool that we looked at, the one with the red flag, that is for the entire registry. So you know you set a limit for the registry. Anyone outside of that gets flagged. But if you want to have more personalized notifications for a specific patient, you can come into the Notifications section and actually create notifications based on any criteria that you like. So in this case, you can see that I have a few notifications already set up. For example, if Nadja's diastolic blood pressure goes below 50, both Nadja and I are sent a notification by email. Now this is outside email, as well as a text message. Similarly, when her systolic blood pressure is more than 160, I get an email or a text. Just me this time. Similarly, for blood glucose, I can do a high or low, and there are several different metrics that are available and can be set at a per-patient basis. So you can really have a tight control over a patient. And these can be changed or modified, and you can also change who the recipients are, as well as how the message is delivered. And then if I click on Add Observation Notification, you can see that there are many different options to choose from. You can choose PEF level, INR, etc. So you have quite a few that you can set a notification for. So it is very customizable. So the next thing we have here is reminders. You can have recipients as a patient's caregiver, or a care team member. And these can be things like upload your blood pressure every day or every week or things like that. So you can see, you can set the time and how often it occurs. Is it daily, weekly, or monthly? So that is another very neat feature, because between the notifications and reminders, you have the ability to really do your interventions and make sure the patient is aware of what they need to do and when. So when I talked a little bit about tracking, we have talked about notification and reminders. But before I get into the health record, I do want to show you the programs. So right here you see 3 links, and these are the 3 programs that Nadja is signed up for. So I am going to click on hypertension, and this is the Hypertension Health Program, and it starts with a goal. This could be something that is customized to the patient, or this could be a general goal for all patients that are signed up for this program. And on the screen, there are several items that I want to show you. Under Care Guidance, you have the ability to add external links or links to PDFs, so it can be used as a place to post educational content. External links, for example, to the American Society of Hypertension, or any sort of health living, health eating websites. So this is really a very good tool. You can also link to, for example, any sort of educational materials that you have on your own website. So this is a good tool to provide education content to the patient. This here just gives you some basic measurements. Again, you can get into tracking from right here. And then, down here, I want to show you questionnaires. So you have the ability to provide questionnaires to users. The content can be customized by the organization. So for example, your company could create your own set of questionnaires and surveys that you want your patients to take, and those will be available to all the patients signed up for a program. So you could create 10 questionnaires for hypertension, and if Nadja is signed up for hypertension, she has access to all 10. And then I, as a nurse, can say, Nadja, you need to take questionnaire 1, 3, and 7. That can be customized, but I'm going to click on this questionnaire to show you. If I select Answer, this is an example of a cardiac profile, so you know you can have all these questions in here. I can select Yes or No, and I can actually save it and then go on to the next page. And if I go back to hypertension, it will show me if a particular questionnaire was taken. So you can see this was taken on May 9th. So you can have different questionnaires. And again, this content can be customized by the organization. And we also provide reports. So for the hypertension program, you do have the hypertension logbook. So right here is where you can print this out. You can actually change the date, the time scale, and you have the same data that was uploaded, not something that was scribbled onto a piece of paper. So similarly, you have general health, weight programs. You could have a diabetes program, where you would have the glucose logbook and diabetes-related questionnaires and educational content. So now I am going to show you the health record. And this is the health record right here, which allows the professional user to enter in data for the patient or for the patient to enter in data themselves if they have access to the application. You can see all the different content. You can add in conditions, allergies, medication. If I click the medication, I can see what medications the patient has taken. I can add a new medication, so I can search it by name, or I can fill it in manually. If I say Input Manually, it's very detailed. You can start with the name of the medication, the ingredients if you have that, medication type. You can go further down, manufacturer, date. If I want to show more, there is an even more detailed view with instructions, description, date it was prescribed, quantity, etc. So a lot of information can be filled into this screen. And of course, the more information that you have in the health record, the more information there is for the nurses to work with, etc. And as I mentioned, this can be manually entered in by the nurse, or if the patient has access, the patient can go in and enter it in as well. You can add in an allergy, immunizations, any procedures they have had. So if I click into Services and Procedures, it is very similar. I can just click Add New, and you can put in any procedures you have had, and you can add some notes. So that pretty much sums up the overview and should give you a good idea of the Navigator platform. Thank you for watching, and if you would like more details, feel free to contact us by phone or by email.